My name is Michael Mabry, and today I'm going to teach you about orthostatic blood pressures. A couple things you're going to need first off is a blood pressure cuff and a stethoscope. You're going to have your patient laying supine. Go ahead and put the blood pressure cuff on. You're going to check the pulse, keep up with your findings, and go ahead and take the blood pressure. And after you do that, you will assist your patient in sitting upright, nice and easily. Assisting them the whole way, make sure they don't fall or anything. Give them about 30 seconds here, and you go ahead and take another pulse rate, mark your reading findings, and then take another blood pressure. And the next step will be to assist your patient to the standing position. Make sure they don't fall. Give them a second here. Make sure they don't pass out, have a syncopal episode or anything. And then once again, go ahead, find the heart rate, take the readings, and then check another blood pressure. And then document your findings as well. Change. All right, and that's good. You can cut that. What? So first thing you're going to want to do is you're going to want to lay the patient supine, which is on the back, and then you're going to want to find an arm that you can take a blood pressure in. Make sure they don't have a fistula or they haven't had a mastectomy on that side. Make sure that the arm's still good to take a blood pressure. You're going to place the blood pressure cuff on their arm. Make sure it's a good fit. And then you're going to take the blood pressure. Check the pulse, make sure there's nothing irregular about it. You get a good reading on that. Then you're going to go ahead and take the blood pressure. Pump it up. All right. So we got 146 over 82. So the next thing you're going to do, you can leave the blood pressure cuff on. What you're going to have them do is you're going to assist them, and you're going to sit up. And while you're moving them from position to position, you want to ask them along the way, you know, if they're getting lightheaded, if they're getting dizzy. If at any point they have a syncopal episode, you want to just go ahead and stop. And this is just going to be too dangerous for the patient's safety to continue with the test for orthostatic. And so after they sit up for about 30 seconds, you're going to go ahead and check that pulse again. Make sure it's still about the same, and then go ahead and take another blood pressure. So this one, we got 142 over 86. So what you're looking for when you're doing orthostatic blood pressure is either a drop of 30 millimeters of mercury in the blood pressure or an increase in 20 beats per minute in their pulse, which is why you always check their pulse and their blood pressure every time you change them. So the next thing you're going to do is you're going to have them stand up. You always want to make sure you assist them, because obviously if you're doing this, there's a potential for them to get lightheaded, dizzy, fall, possibly even have a syncopal episode. So once you're standing up for a little bit, you always want to make sure you have somebody that's there while you're taking the vitals to just make sure that they don't get woozy and fall over while you're doing the assessment. After they've been standing up for a little bit, go ahead, check the pulse again, make sure it's still around the same, and then go ahead and take another blood pressure.
They got to make 11 stations take small, wrongly response, 140 October
And so this is about the same. So in this case, since his blood pressure stayed the same, he didn't have any kind of increase in his heart rate during the whole, between the 3 positions, he's negative orthostatic blood pressure. And cut. Go ahead and take your blood pressure while you're laying down, ma'am. Good, have you sit up, huh? Good, nice and easy. Sit here for a second. You feel lightheaded, dizzy? Okay. Alright, borrow this arm again. Check your heart rate real quick. No. Check your blood pressure one more time. Straighten that arm out for me. Last time, we're going to stand up. Lightheaded, dizzy? Okay, alright. Last time, check your pulse. Alright. Last blood pressure. So that's how you successfully take an orthostatic blood pressure. Again, one of the things you're looking for is either a drop of more than 30 millimeters of mercury in their blood pressure or an increase in over 20 beats per minute in their heart rate. Special considerations, if they get lightheaded or dizzy at any point during the test, you always want to just go ahead and cancel it. You don't want to risk having your patient pass out, have a syncopal episode. And if at all possible, at any time when you're sitting the patient up, or going from the sitting position to the standing position, you always want to try and have at least 2 people assisting the patient upright, because obviously if you're doing this test, they're going to be, probably symptomatic of some sorts. So you just always want to try and be careful with that, and just always take it step by step and make sure you keep a note on your vitals. Thank you very much. This has been an introduction on orthostatic blood pressures.